Hello, I'm Dr. Mini Salunkhe, consultant obstetrician and gynecologist, MomStory, Sahyadri Hospital Annex, Hadapsar. Today we'll be discussing a very important topic called endometriosis. Endometriosis roughly affects around 10% of the reproductive age group women. It is a chronic disease which is associated with moderate to severe pain. Pain may be before menses, after menses. It may be associated with very heavy periods. There might be premenstrual and postmenstrual spotting. The debilitating side of endometriosis is that the pain may be so severe that the woman may start missing her school, college, or her workplace. It may be associated with pain during intercourse and also pain during a passing of urine or stools. This also may be associated with bloating, abdominal pain. It is a very important cause of infertility also. So the aim of taking this discussion today is, it is a disease which can be, if caught early and controlled properly, it is easy for us to halt the progression of the disease. What do you mean by endometriosis or adenomyosis? Many of you may have seen in your reports of the sonography that uterus is bulky, it has become bigger in size, there is adenomyosis, there are adenomyomas, endometriotic deposits in the ovaries and the peritoneum. So what is actually endometriosis or adenomyosis? So everyone knows that when a woman is menstruating, the internal lining of the uterus along with the blood clots and the blood cells, they should all come out through the cervix. What happens in endometriosis or adenomyosis is that the blood, it's called a retrograde menstruation. That means from the uterus, the blood flows retrograde, that means in the opposite direction, and it may come out through the tubes and cause endometriotic deposits in the peritoneum. It might also cause endometriotic deposits. These blood clots and the endometrial cells may deposit in the ovaries, leading to cysts, which are called the chocolate cysts or the endometriotic cysts. It may even to a greater extent deposit in the near the bladder or the bowel. So these are the grades of endometriosis. Several lesions have been found in endometriosis. Accordingly, we grade the endometriosis as mild, moderate and severe. As I said, in the moderate, mild variety, the superficial endometriotic deposits are seen in the pelvis. Then in the moderate variety, there might be ovarian cysts associated with a lot of clotted blood in the ovaries. These are called chocolate cysts or endometriotic cysts. In the deeper variety of endometriosis or severe endometriosis, the deposits are there in the rectovaginal septum as well as in the bowel and the bladder walls, because of which there is debilitating and very severe pain when you are urinating, when you are defecating and during intercourse. So as I said, the reasons for the endometriosis are not very well known, but there might be some retrograde menstruation and the internal lining of the endometrium and the blood cells. You can find these deposits all over the abdomen and the pelvis. Sometimes it is said that if a woman has more estrogen in her body, that leads to more deposits of endometriosis. There is another term called internal endometriosis or adenomyosis. What happens in this is that as the uterine lining gets deposited in the peritoneum, that is external endometriosis, here the uterine lining or the blood cells, they seep into the walls of the uterus. The walls of the uterus become spongy, the uterus becomes bigger in size, and because of this there is heavy bleeding during menstruation, and also there might be some premenstrual and postmenstrual spotting. What is the impact of endometriosis on a patient's health? The quality of life decreases, there is severe debilitating pain at times, and because of the endometriotic deposits, especially in the ovaries, there is impact on the fertility. One very important reason for infertility nowadays is polycystic ovaries and endometriosis. In endometriosis, because the ovaries are full of blood, clotted blood, which are called the chocolate cysts, the anti-Mullerian hormone or the AMH of the patient decreases, because of which it is difficult for her to conceive. So there is also painful physical contact, and in general the life of the patient is affected. Day-to-day life as well as the severity of the endometriosis would depend on the day-to-day activities. How would you prevent endometriosis? Actually, prevention of endometriosis is only that the patient and your caregiver has a very high level of awareness that any type of symptoms which I have told you right now, if you are suffering from those symptoms, immediately come to a doctor. We can evaluate you better and treat those symptoms. What are the screening or the diagnostic tools to evaluate you? If you are a patient of endometriosis, how would I screen you or evaluate you? What are the investigations done? The investigations which can be done are sonographies. If the sonography is unable to pick up some deposits in the pelvis or the abdomen, then we go to a higher screening test called MRI, that is magnetic resonance imaging. The best way to diagnose endometriosis is by laparoscopy, in which we actually put the laparoscopy, that is a keyhole incision, minimal access surgery, in which we actually see the deposits of the endometrium in the peritoneum and in the abdominal cavity and also in the ovaries. So, superficial visualization or actual visualization of the endometriosis is done much better by laparoscopy. Depending upon the symptoms and the extent of the disease, what are the treatment modalities which are available? The treatment modalities available are either medical or surgical. Now, in the medical treatment modalities, the first thing that the caregiver, your doctor would do is to decrease your pain. So, the first thing which we would do is to give you painkillers to decrease your day-to-day life pain which you are suffering from. Secondly is how to regularize your menses and how do we prevent the endometriosis from not growing. How do we halt the progression of this disease? The halting of the disease is done by hormonal therapy. So hormonal therapy can be in the form of injections, can be in the form of tablets, can be in the form of intrauterine devices called Mirena, which is secreting some hormones on a daily basis, and maybe we are able to halt the progression of the disease this way. The second thing which can be done if the medical line of treatment is not they are not curing your symptoms is the laparoscopic adhesiolysis. That means we remove the adhesions. One thing is that when the endometriotic deposits are there in the ovaries and the peritoneum, the blood in nature is sticky. So what happens when these deposits are there in the pelvis and the other parts of the body is that the tissues all stick to each other because of the sticky blood, and this causes something called fibrosis or adhesions, and there is a lot of inflammatory response which is associated. That is one of the main reasons for the pain and the infertility. So when we are doing a laparoscopic surgery, it is to diagnose the what are the adhesions, and also when we put in the laparoscope, we can do the measures by which we can separate the adhesions and help you to probably have a pregnancy to treat the infertility and the pain. So these are the two types of modalities of treatment, either medical or surgical. The early diagnosis and the early treatment can hopefully slow or halt the process of the disease and reduce the long-term symptoms. So I hope my talk was very beneficial to you for endometriosis and adenomyosis, and I hope we can all treat this disease, this chronic disease effectively. I am Dr. Mini Salunkhe, Consultant Obstetrician and Gynecologist at MomStory, Sahyadri Hospital, Hadapsar. For any further queries, please contact the number given below. We are at your assistance 24/7. Thank you.